Hi everyone, I'm Jocelyn, and I did my signature assignment on stroke with the main focus on ischemic strokes. This is an overview of everything I'm going to be talking about. So, etiology, demographics, anatomy, physiology and symptoms, diagnosis and treatment, and an AI model. So, etiology of strokes, mainly ischemic strokes, ischemia, which means reduced blood flow. That's where ischemic comes from. These strokes are caused when a blood clot obstructs a blood vessel in the brain, which causes the blood flow to the brain to become restricted or stopped completely. These blocked blood vessels happen due to fatty deposits, debris, or even other blood clots, and they travel through the bloodstream to the brain, and they usually, most of the time, come from the heart. In the picture, you can see the blocked artery and kind of that cholesterol and that buildup, which causes the blood clots to get uh, dislodged in there. Potential risk factors causing this type of stroke are ambient air pollution, which is just like toxic substances that are man-made or natural that are in the air that get inhaled and get into the body. Obesity, heavy drinking, smoking, high cholesterol, hypertension, diabetes, sleep apnea, cardiovascular diseases, anything that usually has to do with the heart, and just a family history of having strokes or even clogged or blocked blood vessels or arteries. Demographics. Some patients are more at risk than others, and those usually include patients who are over 55 years old. African American and Hispanic patients are more inclined to get these types of strokes, and also male patients or being male. In the United States, 1 in 6 deaths do come from cardiovascular disease are due to a stroke. So that cardiovascular disease ends up leading to a stroke, which causes deaths. And about 795,000 people die each year from a stroke, and about 87% of those are ischemic strokes. So the anatomy, it affects the brain, the central nervous system, the brainstem, and the cerebellum, and it forms in a diseased artery. And with that plaque and stuff, the blood clot breaks off and it travels through the bloodstream and it goes to a blood vessel in the brain, as the picture kind of shows that this is like the diseased artery and there's that blood clot and it broke off from here and it's traveling up into the brain, blocking a blood vessel. And depending on which side of the brain a stroke occurs, it can have different effects. So if it happens in the left hemisphere, it affects the right side of the body. And if it happens in the right hemisphere, it affects the left side of the body. And if it's in the brainstem, it can affect the entire body, left and right side. There are two different types of ischemic strokes, a thrombosis, which is when a blood flow is affected by the narrowing blood vessels. So that's usually due to like the plaque and the buildup in the arteries, or there's an embolic type of ischemic stroke. That's when the decreased blood flow to the brain causes an embolism in the brain and it like bursts. And these two types cause stress on the cells in the brain, which then leads to the cell death. And when cell death happens, it causes disruption of the plasma membrane, swelling of different organelles, intracellular contents that leak into extracellular spaces, and there's a loss of neuron function. Some symptoms include trouble speaking or understanding, so having like slurred speech or just not being able to understand speech when patients are being talked to, weakness or paralysis of the face or the arm. So basically, like when the typical sign is that when someone smiles and one of their sides kind of droops down, or when you have them raise their arms, one of them falls, and doesn't stay up with the other one. Vision problems, it can be blurred, blocked, or they can see double. Trouble walking, they're usually stumbling around, losing their balance, not very sturdy on their feet, and they get a headache, but it's a sudden and it's a very, very severe headache, and they occur based on the location of the blocked blood vessel or when the blood flow is restricted or stopped. Complications can arise when symptoms or even strokes are left untreated for too long. They can cause temporary or permanent damage depending just on how long the brain goes without blood. Some Complications include paralysis. It could be on one or both sides of the body, losing control of muscles, trouble talking or swallowing, memory loss, trouble controlling emotions. You can have pain or numbness in the body, and then it changes in behavior, even being able to take care of themselves. Strokes are diagnosed through different tests like a CT scan, which is basically just an X-ray, an MRI scan, a physical exam from a doctor. So that's when they do kind of like that smile test or the arm test, or even listening for that slurred speech. Blood test or an echocardiogram, which uses sound waves to show how the blood flows through the heart to see those kind of blocked valves and like blood vessels. Treatment, blood flow has to be restored quickly to the brain to treat a stroke. That's the number one priority and main treatment. Some treatment interventions includes emergency IV medicine, which is given to dissolve the clot. So that's like thrombolytic medication or like clot busting, dissolving drugs. But those are only helpful when the stroke is found and treated within the first 3 hours of it happening. There's a stent retriever, which is basically a catheter on the end of a device used to like go in to the body and directly remove that clot wherever it is. Procedures to remove plaque and buildup in clogged/narrow arteries, which is more of a preventative treatment, but doctors will go in and kind of clear those arteries so that blood clots don't happen or travel. After a procedure to remove a clot, the main focus is to return as much function back to the body as possible because, like previously stated, depending on where the stroke is found, it can cause different lack of function to the body. Many patients focus on rehabilitation therapies like speech therapy, physical or occupational therapy to kind of gain that function, to gain that self-care back and be independent as possible. And it's possible for stroke patients to have seizures, cerebral edema, hypertension, hypoglycemia, and so we have to treat for those as well. An AI model that I found was from the University of California, Davis Health. They implemented a new AI model that helps identify patients who are having a stroke or have a stroke. It uses AI to analyze their CT scans within minutes to notice and point out strokes right away of where exactly they are, faster than a doctor would be able to tell. And doctors still look at the CT scans to notice the stroke, but it just makes it faster and more efficient. And it can also share medical imaging across the nation to other physicians and doctors, letting them review scans within minutes instead of getting them like physically handed to them as it normally would happen, especially if patients are being transferred from different hospitals. And it also helps doctors be more prepared when receiving new patients who have lots of histories of CT scans or constantly are having imaging done. It's just a more effective way to be able to see. And these are my references.